let's go ahead and get started, folks. So like I said, welcome to July's session of CS Office Hours. Very happy to have you all here today. If this is your first time joining us, an extra welcome to you. This session will be recorded and available to you via the Help Center. So in case you need to reference any of the content at a later date or share some of the great content we'll cover today with any other team members that weren't able to make it today, you'll be able to do so. Just a heads up, we will have time for a Q&A session at the end of the presentation. Feel free to add your questions to the Q&A tab as our host or guest here, Ryan, is chatting, and we'll address them towards the end of the session. But without further ado, Ryan, if you want to go to the next slide here, we will be covering a new tool that we're very excited about called EHR integration for forms. So I know you saw my question there as an icebreaker. How this ties in is that EHR integration for forms, it gives you the ability to really import info directly from Luma's digital forms directly into some existing EHR fields. So this saves time, minimizes transcription errors, and beats any of your words per minute scores that you're typing if needed, and personalizes the patient experience while also increasing patient readiness. So we have Ryan here, who is one of our product managers and the lead, and really spearheaded this whole project. So really excited to have Ryan chatting with you. Ryan, take it away.
Perfect. Thanks, Bryce. And so, today we're going to talk through kind of this new product offering that we've enhanced our digital forms with to allow, like we said, a lot of more capabilities, both for the patient and for your staff, and in particular for you. So kind of you're going to talk through a couple different scenarios of how this came up, why this came up, and then what we are doing to tackle it in each of these different areas. So I'm going to start by talking about the patient experience and the patient expectation of the check-in process. So check-in is nothing new. Checking in for a flight, for your hotel, all of those things I do on a weekly, daily, monthly basis. And so checking in for a medical appointment shouldn't be really any different. And so the problem that we were seeing was that, checking in can be quite difficult and honestly can, one person who arrives at their appointment time and takes 20 minutes to check in sets your doctors and your providers so far back on that day. And so by moving up some of this checking in process to a digital format, we can hopefully decrease that kind of waiting room time and even help you guys keep a better track on schedule. And so you see this today. Again, this is nothing new to the digital format as well, where Luma is just bringing this hopefully into your waiting room. Instead of going up to your airline kiosk and checking in when you get to the airport, you can all do that online. You can agree to their, I'm not going to bring anything dangerous on this plane. I don't need to check my bag. You can do that before you ever arrive. And so this is the same kind of idea, the same kind of concepts that we're bringing to you and to your patients. And so we think we have, we're going to start offering these solutions and adding to this patient experience. And the idea here is the exact same, right? So your patients can arrive in a more ready state. They can arrive in to your waiting room and not have to experience long wait times because of filling out more paperwork, getting all their histories and getting all their information from them at the time of arrival. Hopefully we're moving that up in the process so that even before they walk in your door, you have all the information you need. So there's a couple different ways that we're going to tackle this. The first one that we came up with was what we are calling our appointment checklist. And the reason that we're calling this appointment checklist is that this it gives your patient the ability to see and clearly define what you need from them before they ever walk in your door. And so you can see in this case on the right-hand side, we've got how this can fit into a reminder flow, for example. And so today we've got the ability to customize this to make sure it's fitting the needs of your individual appointment types or visit types. And so we are going to be offering this and rolling this out to help that patient understand exactly what's demanded of them, and hopefully complete that before they ever walk in your door, so that they arrive ready. And so this can be included. Again, we've taken a platform approach to this, like we have with all of our messaging, which is this checklist, this squiggly, if you know Luma well, can be included in kind of all of our messaging. So that's our reminder flow, like you see on the right-hand side. It can be included in a custom action. It can even be sent manually through our chat hub. So it can kind of work in whatever way makes sense to you to get this into the patient's hands. It can also be sent via email, and obviously it can be sent via text as well. So lots of different customizations that can be made to this to make sure that you are not only getting this checklist in the hands of patients, but you can also see, and I think I have a screenshot later of getting this, what the checklist actually looks like once you kind of click through it. So the idea here is making this as clear, as obvious to the patient as we can of what we need from them. And then kind of once that's the first step, right? That's the first action that the Luma or the staff can take to make this easier for the patient. The second piece that we're going to do is actually help them fill out their forms, right? So going back to one of the question that Bryce asked a little bit ago, I actually might have a faster word per minute on a mobile device than I do on a computer, but I don't know, maybe that's not true. But we're going to help the patient fill out and complete these forms. And so one of the ways that we are going to do that is pre-populating this form with information that we already know about the patient. So this helps them feel known. It also is a more personalized experience. It's an experience that the patient knows exactly, that this was intended for them. This is something that they, you can kind of get warm fuzzies about. If you already know all these things, you don't have to start from scratch every single time. It just makes that extra step to make that patient feel known and appreciated and individual versus just a blank form that everyone has to fill out. You'll notice here, so I filled out, we pre-populated this form with the handful of information that we had on file, but we also won't populate information that we're missing. So for example, in this case, you can see on the right-hand side, we're missing this patient's email. And so if we don't have that email on file, we can make sure that they fill out this form and add that email to give you that more complete patient record on your side. So we can make sure that patient gets the right information, but also don't have to fill out information that we already know about them. I think the coolest part about this is it doesn't just apply to demographics like you're seeing here. We can also do this with some clinical information like medications and allergies, social histories, surgical histories, and some other fields here. So the patient, not only do we know your address or your phone number, we also know the medications that you told us last time you were here. We also know what allergies you may or may not have, or if you have had a surgery somewhere else. You can kind of fill in all that information prior to your arrival. So again, it's helping the patient complete the form, taking just that maybe 10, 20, 30% away from that time of entering and typing in all that information, so that more patients will complete this before their arrival, and you have this information before they ever walk in your door. All right, so that's kind of changing the patient experience, if you will. So those are the two big changes that we're offering to the patient, which is great. But we also want to make sure that this is going to translate to your staff as well, right? So not only are we pre-populating information here, we're also going to take any information that was entered or updated and give it back to you in your discrete fields in the EHR. So what does this translate to? This translates to exactly what Bryce was talking about. It translates to taking your staff from either copying and pasting or typing in manually those entries from the patient. It's consolidating the workflow into a more simple workflow for your staff, so they can just see this demographic information flow in. You don't have to enter anything. They don't have to update anything. And this goes for all those medical history questions and even insurance data as well. So the patient is just filling out the form just like they would normally. Your staff is actually receiving this form or receiving this information back into where they need it, where they care about, where they're looking for it, where the source of truth is, which is the EHR. And again, this all happens prior to arrival. So when that patient does arrive, there may be a double check where, have them coming up to the front desk and saying, I'm here, but that's the only step that they'll ever need to do. And we've even made this possible through a staff review process so that nothing in the chart will change unless your staff approves it. So there's a kind of a new workflow that we've introduced here so that before we put it back into the EHR, your staff can say, yep, that looks great. Go ahead and import that. No, that medication doesn't need to be imported. Advil doesn't need to be imported. Don't import that. So there's all kinds of different workflows that can fit inside this, but this discrete field right back is available on the clinical data set, the insurance data set, and the demographics data set. So lots of different workflows can circulate around this, and we've seen some good ideas and some good workflows exist out there already for different use cases depending on your specialty and your patient population. One other piece of data that is also going to come back is a PDF of this completed form. And the power of this comes into play when we talk about consent forms and policies and agreements. Imagine that all of your scanning of paper documents or scanning of documents into your EHR goes away, and Luma will just put it in the right place for you. That's exactly what we're seeing with our PDF right back, which is that all of those manual scans, all of those uploads have been replaced with this PDF right back. And not only are those consent forms being written back, but we can also just do the general questionnaire. So you have a full documentation of what that patient filled out, what they entered, and maybe it's something that we couldn't write back discreetly. You could always look at it in this PDF format for your completed form. So there's all kinds of use cases for this. We've seen a lot of them come across as far as how this comes up when a patient is scheduling, or even when a patient is due for a new consent form. All those things have come up, and we've seen some good workflows come out of those. We are going to take a brief second to talk through a poll, and I think I can just click this button. Bryce, let me know if you can see that. And we're going to take a moment to answer that poll question, and then we're going to go into a couple of things about what is coming next for this product. See some answers coming in here. Thank you for taking the time with this. Give another 30 seconds or so to answer that. And then we'll talk about kind of where we're going next and go into some Q&A and how we can get this into your hands. All right, perfect. So we'll go close that poll. So one of the things that you may be wondering or maybe thinking, which is always the kind of the
Oops, sorry guys, it looks like Ryan may have had a technical difficulty, but he's back.
I was clicking
but
the
he's
button,
back.
All right. Thanks, Bryce. So I'm going to try this again. Let's see if this shares. Can you click that what's next for me, Bryce?
Yes. Sorry, let me check this out. There you are.
So yes. Okay. So where we're going next? How does this fit into your specific workflows. How does this fit into kind of what your admin staff is doing today? So one of the things that we have seen and been asked a bunch of questions is there are any number of customized fields or specific EHR fields that you guys want us to support. And so where we're going next is we started with a standard set, right? So we started with a handful of standard data sets, demographic insurance data sets, clinical data sets that we have seen that go across EHRs. So that's where we started, and that was intentional. We wanted to start somewhere and offer some level of this bi-directional capability. And where we are going is we're going to start offering more specific, more maybe even specific EHR fields that you guys use and want to have want to have written back discreetly. So those are kind of where we're going next. We've even started to kind of experiment with some of these fields in some EHR. So more to come there, and always more. There will always be another field out there somewhere that you guys would want us to hit. So we'll always take those into consideration. Other EHRs. So this is a good question that may apply to some of you today, and some of you already know this, but we have started with a handful of EHRs. So maybe yours, maybe not. So ECW, Meditech, Centricity, and Cerner have been completed. We are working on adding to that list, and so you'll see some other EHRs get added. Athena and NextGen specifically will be added here shortly, and there'll be more in the future if I didn't mention your specific EHR. So we'll always be adding more to this list and enhancing our integration across all of our clients. It'll just take us a little bit of time to get there. So if you have one of those EHRs that I mentioned that we're working on, or one of the ones that we're going towards, stay tuned. You'll hear more from us about that shortly. And then again, kind of working backwards to that patient experience, we're also going to have a more customizable or a different workflow supported around how those checklists get used. And so this may be a provider-specific checklist, a specialty-specific checklist that maybe the visit type or the appointment type wasn't specific enough, for example. We're going to start being able to customize those checklists on a variety of different fields. So those would be even more dynamic and even more broadly, could be more broadly used across your organization. So it may start in one department, but it could be broadly used in other departments as well. So more to come on what those will look like and how those will come. And then, of course, as with all of our products here at Luma, the more information, the more usage this gets, we'll have Bedrock recommendations. And so if you don't know what Bedrock is our data analytics backed best practices. And so as more patients start to use this, as more workflows come out of our pre-populated and right back, we'll have best practices for you to make sure that those patients do actually show up ready and are able to complete this ahead of time. And if there's a question or a group of questions that maybe you need to ask further out, things like that, we are starting to explore what that would look like for what our Bedrock recommendation here is, both for the patient side of the house to make sure that patients are completing it at a high rate, and also for our integration to making sure that we are putting that back in the right place at the right time recommendation as well. So more to come on what those look like, and more to come on what those will actually translate to the workflows. But we're getting close on adding some of those customized fields and other EHRs. Now, I know, again, this is at a high level, this is always great to talk in big kind of big scope, but it's always about what about my specific workflow. So we're going to dive into some question and answers here. I know that there are some chats that I've been ignoring. Yes, I'm perfect. So Jennifer, you were asking about Athena Health. Yes, Athena Clinicals is on the roadmap. We will have some capabilities here very soon. We have kind of started the investigation into what it would take to get all of this writing back into Athena. So more to come there. We do support, if you're on Athena practice, we do support Athena practice for Centricity today. And then Guillermo was asking about eClinicalWorks. Yes, we do have this available for eClinicalWorks and both types of integration that we offer for eClinicalWorks. So yes, I'm happy to answer any other questions you may have live as well.
Yeah, please send in any questions you have to the chat there or the Q&A tab. This is a great time to get those answered. Ryan's a great resource for anything and everything EHR integration for forms. So please, please, please pop those questions in here. It looks like Jennifer has another question. How will I be updated about the integration process with Athena?
Yeah, great question. So there's a couple processes that you will be able to, that will maybe notify you in different ways. So I'll actually maybe skip ahead just to the slide. So the first one is in our help center. We will have the EHRs that we support, the fields that are supported for that EHR, how to set up these forms, how to set up a checklist. All of those will be available in our help center. So stay tuned there. You might see some articles coming your way. The other, I'll actually leave that on the screen. The other way that is our CSMs and our team will be reaching out when we are able to offer this new EHR, this new field list, whatever the case may be. We'll be reaching out and having a conversation starter there as well. So multiple different ways. You might even see it in our release notes. There's all kinds of other ways that you might hear about this for different EHRs as well. Of course. And again, going through this. So if you have one of the supported EHRs that we mentioned, so ECW, Centricity, Cerner, and soon to be Athena and NextGen, you'll see this in your help center. They, again, depending on your integration that you have today, you will see your specific integration field list. You will see how to set this up on a form. You will see how to get started with our appointment checklist. All of those things will be available to you kind of soon after this call. And of course, our CSMs will help you. Our CSMs are more than willing to help you get this set up as well. So I see a different Jennifer asking a question. Does it work with ECW server as well as cloud? The answer is yes to both. So we have the integration set up for kind of in our ECW integration types, which are self-hosted ECW or cloud-hosted ECW, either one. We can support it on both. And as of today, those field lists are the same, but that could change again depending on what those specific customized fields are that come out next. I do see a Q&A. Sorry, I missed that one. ModMed, great question. As of today, it's on our list to tackle. ModMed is on the list to tackle today. We do not have support for it today. So another good question. Kind of going back to where we're going next. We'll be tackling some more integration, different types of integration here soon.
Any other questions, folks? It looks like that is it for now. So we will wrap up this session. A big thank you to Ryan for joining today, providing this information, and an even bigger thank you to all of you for cutting out 30 minutes, joining us today, taking a minute to learn about some of these new tools that we hope will help streamline some of your workflow. So Ryan, if you want to jump to that last slide there, we can check out what is to come next month, which is really exciting. Schedule with Google. So if you haven't heard about this, hang tight. You'll get all the info you need in August if you come on and join us again at CS Office Hours. So we look forward to seeing you there. Jennifer, I do see your last question. Is there a slide deck available for this presentation? Yes, a recording will be sent out with all of this, and I believe that you will have access to the content in the deck as well. So we'll be sure to get you the resources you need. Again, thank you everyone for joining. Really appreciate it, and we'll see you all next time.